Welcome to the TechLink Health Podcast, an on-demand source for the top trending healthcare topics and insights. Delivered by key opinion and emerging leaders and as featured on the TechLink Health app. The healthcare industry is rapidly evolving, so our goal is to connect listeners to the most relevant insights, ranging from digital health to financial well-being to interesting side gigs. For more details, visit www.techlink.health.
Welcome to this episode of the TechLink Health Podcast. I'm Govind Shantharam, and I'll be hosting this episode. This episode dives into a range of emerging technologies that are helping to shape the future of health and well-being, from Web 3.0 and blockchain to sustainable health ecosystems and precision medicine. This episode's guest is Dr. Samantha Nazareth, who's a practicing gastroenterologist, thought leader in the space of digital health, CMO officer, an advisor to several startups, and one of the founding advisors for the TechLink Health Initiative. Sam, thanks for joining us today. It's great to have you as a guest.
I'm excited. I know you have masterly prepared very tough questions, so I'm ready for them.
Excited as well. Look forward to your insights. To start, all of us have many ways to identify our core strengths and interests. You identify with the transhumanist philosophy, which in general is a term that many people don't readily identify with. What's the significance of the philosophy, and what's your point of view on the role it plays in shaping the future of health?
I want to start by just defining what it is, transhumanism or being a transhumanist. It's simply the thought that using science and tech in order to enhance humans, us. It's sometimes called like human enhancement technologies and can be very fancy by saying it that way, but it's even simpler than that. I use the example of something that we don't think about anymore, but the invention of the wheel is a simple technology, and it's helped us do many things as human beings, helps us travel and get to places faster. I would say that in my lifetime, the first tech that made me cyborg-like was when I was 7 years old, and people definitely raise eyebrows when I say, wow, you became a cyborg at age 7. Well, it's something simple as needing to have and wear glasses. Glasses is technology. It's simple in what we think of as technologies now and even emerging technologies. But with glasses, I still remember to this day, second grade, my teachers all saw me struggling as I was squinting, and they knew right away that I needed glasses. But me being that age did not know that that's what I needed. But as soon as I had the glasses on, I could see much better. I could do my homework better. I could get on with my day. And then even more advanced than that is things like exoskeletons that you can use to carry more things. At the very heart of it, it's really the idea that we understand our bodies are weak and our mind is constrained by time. There's simply not enough time to do everything. But what's infinite is our ability to create and our imaginations. And even beyond that is our empathy. Those things are infinite. But technology really lifts us from those two constraints of both time and space.
Completely agree. And those are great insights, which is a good segue into our next topic, which focuses on technologies that are emerging as key themes across industries, particularly blockchain and Web 3.0. And while these technologies are increasingly becoming familiar, to many, these terms may not be as mainstream. So from your point of view, how would you define these terms, and what role do they play in creating a healthier future?
Mm-hmm. It's almost like a history of the internet. I would have to start with where we first ended up, which is Web 1.0. And I remember things like Alta Vista and even AOL. That was the magical dial-up that was music to my ears, waiting to see if I had, You've Got Mail. But it was basically a set of static web pages. Didn't have to go to the library anymore. It was a way to really find what you needed in terms of information. that's what I would call Web 1.0 was really the internet of information. And you see the rise of an expert. You don't have to do anything. You could just be at home and look something up and become an expert on it. If you remember, though, it wasn't very fast and it was not really comprehensive enough. There were things there that could have been better. Then we moved to Web 2.0, which really is the rise of social networks. You really can interact with people better. There are a lot of social media platforms now. Even as someone in my home, I can become a content creator. I can become an influencer and either create content by blogs or videos, vlogs, you name it. The thing that happened here, this is where we are, is a lot of data is being basically housed and centralized by major tech companies. Everybody's kind of aware of that. That's what's happening. It's sort of the hoarders of data. I kind of equate this to when Beanie Babies were really popular and everybody would hoard Beanie Babies. It's like that. It's like our data is being hoarded. What we're entering now, driven by what citizens want and also regulations, we're going into Web 3.0, which is more human-driven or person-driven, user-driven, where it becomes an internet of value. And previous versions, Web 1, Web 2, there were a couple of layers to it, but part of it is you weren't really sure you can trust the aspect of the transaction. I didn't know who was behind the content, if it was true, if it was good in the sense that I know it's a credible source. And it was more of, if you think about it now, we're getting pushed ads and a bunch of other things we don't want. Web 3.0 is really a pull. It's me interacting, but I pull what I want. And that's the feature that really interests me because it's really driven by us as people. It's not things that are pushed to us that we may or may not want to see.
Very interesting points. What are your thoughts on how these technologies will converge, particularly blockchain and the way data is used alongside of emerging technologies like AI or ML? And how will this convergence impact the healthcare industry?
It's always, everything builds on each other. And what I mean by everything, it's different technologies build on each other in conjunction. So things aren't isolated. So it's not like it's just blockchain. It's going to be blockchain plus. Even AI, it's AI plus. Even the ability to store large amounts of data have really exponentially driven other sectors. Just that alone of storage of data and the ability to store lots of it has helped other things move further along. So what I explain is that it's not just simply blockchain alone. It's always blockchain plus. And it's really dependent on what the industry needs. So healthcare, there's a lot of aspects of healthcare that really can benefit from the features of blockchain plus the features of something like artificial narrow intelligence, which is where we are now. But in the future, we'll be speaking more about artificial general intelligence. But it's always in combination with.
Interesting points. Switching gears a bit, there's an interesting scientific reference that DNA is about 1 million times denser than hard disk storage. Technically, 1 kilogram of raw DNA could store the entirety of the world's data. What role does the power of genetic discovery play in shaping emerging technologies?
I'm a scientist at heart because I'm a physician. So I love DNA the minute that I learned about it. And nature really made it beautifully. DNA, if you're equating it to a storage of data versus what we have now, which is 0-1 binary. DNA, you could store more information in less space because it's taking into account both the spatial components of the double helix. So that's not flat, but also it has 4 codes. So it's even more exponential of how much you can store in less amount of space. I know it from the DNA scientist aspect. And of course, if you have a computer scientist or an engineer on one of your future podcasts, it'd be interesting to hear their point of view from their perspective. But it's really this information. Our programming is on DNA, but nature made DNA very beautifully in the fact that it holds a lot of data. A lot of data.
Interesting points. It'll be amazing to see the new discoveries as our understanding of DNA continues to evolve. On that topic, you mentioned the current pandemic, which has caused many to be forced forward into the future, which presents a unique opportunity for us to collectively, as humans, determine what that future looks like. As we move toward more advanced times, such as the biorevolution and innovations like biomachines or biocomputing, how can societies prepare for these more frequent leaps forward? In 2030, for instance, what will we be talking about?
Yeah, 2030, 10 years from now. I like to think of it broadly and then very specifically in the industry that I'm in, which is healthcare. Broadly speaking, our problems are becoming more and more global and borderless in nature. And that can mean economic, it could be infectious like this pandemic, it could be climate related, and borderless, meaning that these problems are not just for one country, it's a global issue. And thus it speaks to the need for technologies to be distributed, that we need them by design to be distributed. So for example, artificial intelligence will become decentralized in the sense of federated learning. The internet will become decentralized as a D-Web, and even finance is becoming decentralized in DeFi. Specific for health, it will also become decentralized, and it's already happening now. I look to the growing sector of medical tourism, where individuals are seeking care outside of their local communities, meaning that they're taking a flight, could be a different location within the same country or even outside of their country, far, far distances to get medical care or medical procedures done. Will care be global, meaning that a physician in one country on the opposite end will be treating someone here in the US? Obviously, there's the legal and regulatory aspect of it, of handling a market that's global. But that's what we're really looking at, is things just becoming more and more global in nature. And then even more specific in healthcare, what has been trending is this push to have everything done at home, to do what's most convenient. So all the hospital care, as much as possible, of course, to be done at home. And with advances in remote monitoring and sensors that can capture more and more unique data points that are clinically relevant, it basically pulls all that remote monitoring specialized to an individual patient sitting at home. I think that's really where we're going, is having basically healthcare in different ways managed in different settings. And this is speaking to the whole issue of, not issue, but really everything becoming distributed and decentralized.
Completely agree. One of the founding principles of TechLink Health is the concept of distributed intelligence that's scalable, accessible, and can be deployed to improve healthy outcomes from various touch points in the healthcare journey. What do you think of the value of platforms like TechLink Health are, and how does it align with some of the initiatives that support your interests in shaping the future of healthcare?
I like the term more collective intelligence. And if we look at nature, it works in, I hate to use a swarm mentality of like bees, but that's really what it is, that as a collective, we are much better and we work better and we get things done better. For big problems, it requires collective intelligence. If you take, for example, what's happening this year for COVID, it's going to take multiple countries to solve this issue. So you need multiple data sources in order for big solutions. And that's what I love about it, is that idea of collective intelligence, that all of us coming together, we create bigger and better things.
Great points. Another topic of interest is the emergence of precision healthcare and being able to use some of the data that's out there and the technology to really pinpoint precise solutions. What are your thoughts on precise medicine, and in what direction is the technology headed?
A lot of it really speaks to how far we've come in the genomic scene, that we've been able to sequence the genome. We don't have to make assumptions based on observations seen in people who look like me. We can be treated based on what our DNA programming is. And even beyond that, because then there's the whole aspect of epigenetics. So behaviorally, what we do, and even environmentally, what we're exposed to, and how all of those factors play into a really precise treatment and personalized to our DNA. That's really the holy grail, is treating someone differently based on all of those data points and not just on assumptions based on observations that we've seen in the past. If you happen to fit a certain demographic or have certain family history, it's really just getting down to the deep programming of the DNA plus what we're exposed to and our behaviors, and having all of those data points and creating this really personalized treatment plan. Also, it's not just a one and done thing. I see it as something that's every day that can be a plan proposed for you, because our lives are different day to day, year to year, decade by decade. Our bodies are changing constantly. So the one-time treatment for all of these data points, it doesn't make sense. But to have it ongoing and to customize it for someone in their specific situation at a given time, that's really amazing.
Amazing indeed. As we move toward a post-pandemic environment, there's the sense of an anticipated wave of innovation. What types of initiatives will you be involved in as you look toward the future?
I really, even before COVID happened, there was always this, in my mind, a connection between health and economy. And then the pandemic happened and everybody really saw it happening play by play, that health and your economy are very intimately intertwined. And that's why having the knowledge of certain technologies that can link the two together is what I'm interested in. And especially not just locally, but globally, in places that don't have infrastructure. I think people have this idea that, oh my goodness, if you're doing this fancy technologically advanced things, what kind of equipment do I need? But that's the beauty of some of these emerging technologies, that you don't really need a lot of equipment. It can be done without fancy infrastructure. And that's another amazing aspect to it. So that's really what I'm working in and with, is bringing that to the masses, is that ability to bring these features of certain technologies and have it linked to health, meaning that your health is your wealth, or your health is a slew of data. And everybody knows that anything we're doing, whether it's in health or financial patterns, it's all producing data. But that data can equate to something. It can equate to either incentives, and people think incentives can be money, but it doesn't necessarily have to be money. It could be discounts, it could be access to things. But that's the beauty of it, is linking incentives to health and really pushing forward aspects of health that we want to incentivize.
Those are absolutely interesting points. Lastly, we always like to explore personal hobbies with guests during the episode. You're an avid scuba diver, and I'm curious, what can the world beneath the sea reveal about our realities on the surface?
I've always been a curious person, and even more curious about things I wasn't able to see very easily. And of course, there's the option of snorkeling, but I said, there's a lot more happening down there. And I finally, and for anybody who's never had the pleasure of scuba diving, it is quite a surreal experience to do it for the first time, to breathe underwater with equipment. That takes a little bit getting used to, because usually your lessons are done in a pool. My first lesson was actually done on open water, but I've been with beginners and it's a sense of claustrophobia, but all of that goes away really. And I almost feel like you become at peace, especially when you do it in the ocean because you're so mesmerized by everything that was happening under the sea and all the things that I really would never have experienced if I snorkeled, just by simply the depth and getting under all the nooks and crannies of things that you just simply could not have reached by holding your breath. I'm a scientist at heart, so I always think about organisms and how there are certain rules that we all behave under. And that is also the case when you go under the water. And these lessons I've seen by just simply observing sea creatures, that we all inherently want to survive and we all adapt to different conditions. There were many organisms that I was able to see that only come out in the dark. They don't really survive on much oxygen. They only survive on certain depths of water. But we all adapt to our conditions around us in order to survive. But also, what is another beautiful aspect of nature is this ability to really connect with the other creatures, whether we can see them or not, that we are all connected under the water, above the water. Everybody has almost, and every animal, every organism is living in a larger ecosystem, but it shows the connectedness that all of these organisms have. And you really see that underwater, especially during kind of peak times when a lot of animals and a lot of large animals are out and about. All the fish, they behave differently, but still within this flow with bigger creatures like sharks and sea turtles. I've seen big, large stingrays. I've seen sea turtles mating. But it's just this interconnectedness that I think that's really the lesson that I learned with scuba diving, and that even organisms that you can't even see, we're all very similar. I've been to 10 different sites, but as you know, you go a couple of times. And my first dive site, I have to say I was really spoiled because I did it in the Great Barrier Reef. And I know that it's unfortunate that the state of the reefs have been kind of decimated. But that first experience, it just opened up my world like completely to say, I have to do this again. And really this appreciation of the world that I was never able to appreciate. Well, I'll even tie it back to the beginning question, or the answer that I gave is without technology, I was not able to do any of that. Without all the equipment that you need to dive, you can't appreciate that world underneath the surface.
Absolutely amazing. It's always interesting to hear how experiences shape our perceptions. Well, Sam, we want to be respectful of your time. So in closing, any final insights or recommendations for those interested in staying connected to the next wave of innovations in healthcare?
The main message for everybody is just to have this level of curiosity. It's almost like that student-like feeling that we had when we were younger, of this hunger for learning things and curiosity that maybe as adults has been pushed aside. But I argue that we really should just keep feeding that, because that's what really stretches our minds to think that and believe that things out of the ordinary can be possible.
That's a great message, and one that I'm sure will be useful for our listeners. Well, thanks, Sam, again, for your insights during this episode, and we'll wrap it up there. Thanks again.
Thanks for listening to this episode. TechLink Health is a healthcare advisory platform for consumers and organizations to stay informed with the latest insights while connecting with healthcare experts for telehealth, e-consults, and consulting services. For more details, visit www.techlink.health.